Hey, this is Matt. Welcome back to the channel, guys, where I'm going to be sharing with you a review video or introduction video to a hair transplant clinic called Eugenix in India. And this video will have two main parts. In the part number one, I'm going to be sharing with you some details, some things about Eugenix hair transplant clinic, which you really need to know before you decide to get a hair transplant with Eugenix, things that separates Eugenix from other clinics doing FUE hair transplants all over the world. And in the second part, we're going to be taking a very good look at some of their before and after results, before and after photos and videos on their YouTube channel, observing their hairlines, their temples, their density, their crown area hair restoration, female hair restoration, and repairs, obviously. So if this sounds good to you, make sure you stay tuned until the end of this video. Before we start, this video has been brought to you by GoFiber, which are hair building fibers you can use to mask any thinning, any patchy areas on your scalp to make your hair look thicker and better. So make sure you check out the link in the description below where you can visit GoFiber, get a free sample of your choice from them, and try them out, see if you like them. Guys, welcome back to the channel. If you are new, make sure you subscribe because I talk about these topics, hair loss and hair transplants, all year round. So make sure you also check out my free Facebook group, Hair Transplant Experiences, with over 2,500 members in the group. Check out mattdominance.com if you want to inform yourself further on things like how to do the proper hair transplant research, how to find the right doctor, how to maximize the likelihood of getting a successful hair transplant. So let's just start with the part number one right now. Hair transplant clinic, Eugenix Hair Sciences in India. I wish I could visit this clinic right now and give you even more in-depth review of this clinic, but unfortunately, because of the travel ban to India, I wasn't able to do so. And that's why I decided to get in touch with Dr. Arika Bansal and Dr. Pradeep Sethi, who are the founders of the clinic. I decided to get on a Zoom video call with them and ask them several questions. They also showed me the clinic via camera, like video. They also sent me some photos, additional videos, and answered all of my questions. They're ISHRS and IAHRS members as well. And they're obviously training all of their new coming technicians, or training their senior surgeons already, which by this time some of them have already 10 years of experience. Their youngest team members have 3 to 5 years experience of working with Eugenix. They have centers in different cities in India where they do either consultations only or consultations and surgeries. Consultations and surgeries they do only in Delhi and Mumbai, in 2 Indian cities. Overall, they have already performed 9,000 hair transplant surgeries, FUE surgeries, obviously, with utilization of body hair. That's what they like to do as well. Now, as far as the doctor involvement and the daily patient volume, they're doing about 4 patients on a daily basis, with either minor or major involvement of Dr. Pradeep Sethi and Dr. Arika Bansal in the procedure, based on what type of package the patient will choose, obviously. All the important incisions, all the important extractions, like crucial extractions, and important incisions like slits on the hairline, the temples, and crown, whirl pattern hair restoration, these are all done by Dr. Pradeep Sethi, Dr. Arika Bansal, or their senior surgeons. For me, another great sign that the doctor wants to make that hair transplant right would be how much time he's willing to invest into the hairline design, hairline planning, and the overall consultation before the actual hair transplant. And after asking this question to Eugenix, I got an answer that usual consultation that they do before the hair transplant takes about 30 minutes. So that tells me that Dr. Pradeep Sethi or Dr. Arika Bansal are both willing to invest about 30 minutes or sometimes even more if there is more complex case like a repair or over-harvested donor area. Then they're even willing to invest even more of their time to plan everything properly, to design the hairline properly, and to measure the donor area properly in order to avoid further over-harvesting. So that's already a great sign for me that this clinic has the patient's interest as a highest priority, because there are in fact other clinics where the hairline design, hairline planning takes maybe 2, 3, 4 minutes. In some cases, the doctor doesn't even speak to the patient properly. He just designs something and then sends him to his nearest technician team. It shouldn't be like that. So with Eugenix, it's not like that. That's important to know. If I had to summarize you the most important aspects of their 3-step hair transplant approach, extraction, incisions making, and implantation at Eugenix, it would be like this. Extraction is done by using micromotor device, extracting up to 3,000 grafts per day, and if patients require more grafts than 3,000, a 2-day surgery is recommended. They customize the punch type, size, and diameter required for every patient. Their surgeries, as you can see, are always complemented by the use of Carl Zeiss magnification loops of up to 8 times. They also make use of the Carl Zeiss operating microscope with a magnification of up to 21 times in order to, for example, carefully examine the selection of the fine single grafts for the temporal hair restoration. The incision making phase is done always by the doctors, and here we come to the DHT, direct hair transplantation method, which Eugenix utilizes, and it means that the extraction and implantation are initiated simultaneously, and thus the time out of the body of the harvested grafts can be minimized on 2 to 30 minutes only. The advantages of the DHT hair transplant approach are better survival rate of the graft. For the implantation, they use their own Sava implanters, which are actually just placing pens of different colors. The difference in colors, as you can see here, denotes the size of the bevel of the implanter. The single follicles are loaded into yellow implanters, doubles into white, and multiple follicles into red implanters. These implanters are not like the usual Choi pen or implanters used in the DHT technique, because the Sava implanters are blunt, not sharp, since the incisions have been already done before the Sava implanter is used only for the grafts to be loaded into the implanter and then implanted together with a special type of forceps. If you want to find out more about the effectiveness of the DHT procedure and how it reduces the graft out of the body time and also minimizes the physical handling, mechanical trauma to the graft, and chances of graft desiccation or hypoxia, check out the study Eugenix has done on the DHT method back in 2013. I will link it below. Important to say is that they also maintain a complete count on all of the grafts extracted, tracking the single, double, and multiple grafts, and they take care that they are implanted accordingly in the areas they need to be. Let's start with the demonstration of some of their before and after results, and rather than taking a look at their Norwood 2 to Norwood 7 cases, I'm gonna be more selective here. I'm gonna be trying to share with you their results based on the area where the result had been done. Was it a temple? Was it the hairline? Was it the crown area? Was it a male or a female? Was it the repair or not? Alright guys, so let's start with the first example of temporal hair restoration, but also hairline restoration, where Dr. Pradeep Sethi is explaining how he's doing it, what's important, what doctors should definitely do and be aware of when trying to restore temples. So here you can see how he pretty much dense packed the temple and hairline. That's the result, guys. Look at that. And the patient has even pretty fine hair. This is not the type of the typical patient with dark hair and thick hair, not really. He actually seems to have quite fine hair. We can see the softness on the temporal hairline. We can see the sharpness of the temporal point here. It looks really good. You would probably never think it had been restored, and the frontal hairline is also very fine, very soft looking, consisting out of many single grafts. Okay, really good result. We see similar dense packing also with this patient. I don't really think that the dense packing is better compared to the last case, but you will see that this patient will be able to achieve better thickness because his hair diameter is better, obviously. So I don't think that they did a better density on this patient. He was just a slightly better candidate for a hair transplant. You can see very symmetrical temporal restoration. It's actually pretty symmetrical from both sides. And this is the patient. After 3 months already, we can start seeing how the temples are starting to fill. And take a look at the hairline and temples after 1.5 years. This is a close-up video. Look at the very soft singles on the temple. One of it is almost like already starting to turn white here. because the doctor had to especially fish for these less pigmented single grafts, not that black or dark looking single grafts, which are also growing slower. And he implanted these grafts under a very tight angles, very close to 5 degrees. It's very tight to the skin. It just blends nicely with the hair all around here and creates great naturalness overall. You wouldn't be able to tell probably that this temple was in fact transplanted. Here I can stop again so we can see the reconnection between the temporal hairline on the left and the frontal hairline from the top. We can see that the single grafts are a little bit darker, the ones that had been placed on the hairline, and the singles placed on the temples, they're a little bit, even a tiny bit thinner and a little bit less pigmented. I don't know if you can tell the difference, but that's how most experienced hair transplant doctors see that, and that's why how they differentiate between very, very soft singles and the usual singles. So that's even the next level, which some doctors don't really do. They just see a single as a single, and they don't really do another like next level classification between like single category or soft single category and the usual maybe more robust looking single category. Okay, so these were the temples. Here you can also see another of their awesome result. This was another patient, Caucasian patient with light brown hair, I would say, and even after cutting that temple very short, you cannot see a huge difference between the hair behind the temple or the hair on the side and the restored part of the temple. It looks really nice, it blends nicely together, and it's been only 6 months, by the way. If we talk about the hairline, one thing I want to point out is how they create the softness on the hairline. Softness means that there are going to be many single soft hair follicles transplanted, which only produce one single hair, obviously. And how they do it, they transplant 500 single follicles usually, and they place them irregularly to create a softer gateway to the face. Okay, that's how they do that. And after 4 months, we already see a pretty good coverage, to be honest. And look at the crown, it's already like almost full. So you can see his hairline right now after only 4 months, by the way, and you can already see how soft the hairline looks. Okay, it's very fine and very natural looking. In order to demonstrate the naturalness and softness of their hairlines, I'd like to also I'd like to take a look at this video where they're combing through one patient's wet hair. Here you can see very well how the first half of a centimeter or almost a centimeter is the soft transition zone consisting out of single grafts only, and after this zone there is going to be the more robust looking zone consisting out of doubles, triples, and so on, which is creating more density, more coverage, and decreasing the see-through effect. If you start looking at many of Eugenix results, you see that they have their own unique style of doing the temples, doing the hairline. Obviously, temples only on candidates who are suitable, who can get away with it. Maybe they are already older or maybe younger, but the donor is good, the further hair loss potential is low, stuff like that. One thing it's important to take a look at is always how the hair on the hairline blends with the hair on the temporal hairline, how it all kind of matches. And here you can pretty much see how uniform it looks, how well balanced, how well blended it looks, and it's a really great result overall. So their ability to create hairlines, it's very natural and blended with the temple, creating very seamless transition, and you don't see any issues with it. It just looks good, it just looks great. And if you are not a hair transplant doctor yourself, you're just a random person on the street, you would never think that this patient has a transplanted temple or hairline. Or I guess another important aspect of hair restoration is obviously the proper crown area or vertex hair restoration. And it's not just any random hair restoration, but it has to have a structure, it has to have an optimal pattern under which the hair kind of is directed and is pretty much implanted. As you can see here, even though this patient is miniaturizing on the crown, we still see how the previous pattern used to be. You see that whirl kind of right in the middle of that balding circle. And when this patient decided to visit Eugenix, Dr. Sethi immediately designed a similar whirl to what the patient used to have, and this allowed him to create an optimal result on the crown with only 2,300 grafts. Look at that. That's pretty good. That's pretty good. Very natural results, by the way. All right, guys, before I share with you some female hair restoration cases and the repair cases from Eugenix, let me give you some brief comments on this patient who was like Norwood 6 to Norwood 7 transition, and he decided to get a hair transplant at Eugenix. He received 7,036 grafts in total. Out of these 7,036 grafts, there were 1,413 beard grafts, as you can see here, and 5,623 scalp grafts, which were taken out in 2 days. So it was a 2-day procedure. That's how the donor looked like immediately after the procedure, after 2 days. And this is again the patient's before situation. We can consider him a Norwood 6 to Norwood 7. He's slowly transitioning into Norwood 7. And 7,000 grafts in such a case is really necessary if you want to get satisfactory coverage all over. Now let's skip to the end result, and we can see how the patient is now combing his hair after 1 year. We can see how his hairline is very soft looking. Even when he decides to spike his hair over here, we can see how the hairline has many macro and micro irregularities. It's not a straight line, obviously, because the patient is also 46 years old and it wouldn't look natural on him. We can also see the same result from the side, and this is only 7 months after the hair transplant. Here we can also see the soft start of the hairline. We can see many single grafts in the hairline from this angle as well, and it looks also very good when the hair is short. The donor area looks very, very clean and homogeneous from the side, despite the previously done follicular unit extractions. The crown area was very, very bald before, and after the operation it grew in. First of all, we can clearly spot the whirl pattern reconstruction, which starts in the center here and then kind of the hair is kind of changing the direction. The whirl is there. It looks great. It looks natural, and it has been done in a proper way. So this was again just to show you Eugenix ability to restore hair also in Caucasian patients. And now let's take a look at some repair cases and female hair restoration cases of Eugenix Hair Sciences. As far as hair transplant corrections, it's very important to find a doctor who can do corrections as well, because that just shows to the patient that this doctor is really skilled and he has seen many cases. He can also correct what somebody else has messed up, because many doctors don't want to do corrections. They just reject such patients because they cannot repair it, or they're not experienced enough to repair that. But this is not the case with Eugenix. As you can see, they're able to do all types of repairs. For example, with this patient, they removed first the pluggy looking grafts from the hairline, and the hairline had been also positioned way too low. As you can see, it's 5.5 centimeters. So they wanted to make it like higher. I guess they went to 7.5. So they removed these poorly transplanted grafts, and they transplanted new grafts on these areas. The placement didn't occur on all of these areas, but they did place new grafts only between the existing hairs, and they went a little bit outside of the hairline. But still, you can see that the result looks much more softer here, even if I cannot see it in a very high resolution, unfortunately. I wish this picture would have better resolution, to be honest. On this patient, you can see that the grafts transplanted on the temple are off. You can see that this thing here is pretty much doesn't have the right angles either, and the density is also lagging. So what Dr. Sethi decided to do, pretty much, he decided to transplant new grafts in between and removed some of these grafts which had been placed on the temple poorly. 6 months it already looked like that. The last thing I want to take a look is female hair restoration. Look how the hairline is different here compared to the male hairline, right? It's much more rounded. It's not that edgy. It doesn't create such a strong frame around the temples. They obviously transplanted the hairline and added more support to the frontal forelock area of this female patient. And if you take a look at the result, we will see many singles. Many singles. We can see a lower forehead here. We can see very nice result. Look at this. Look at this from the side. This is all transplanted pretty much. Not just the hairline, but also the temporal region on the right and left. So if you are somebody with thinner hairs, you know, you are afraid that the clinic will not transplant the hairs in such a soft way, or will not pay attention to the fine hairs being placed on the temples and hairline. You can see here that even with the female patient, you can see that softness very well. All right, guys, that was the end of the part number 2 as well. So the part number 1, part number 2, that's the end of the video. I hope you enjoyed that. If you did, make sure you smash that like button. Did you smash it? I hope you did. If you didn't, smash it right now. Make sure you subscribe to my channel. Make sure you check out Eugenix, check out their website if you want to see more of the cases that I haven't touched onto in this video, maybe Norwood 5, 6, Norwood 7, higher Norwood classes, and how Eugenix is able to do that. So make sure you check out their website. You can go to results and check out some of the higher Norwood classes. There are many of them. They look awesome as well. So make sure you check them out and let me know what you think. If you are new to the channel, make sure you subscribe. Check out my free Facebook group, Hair Transplant Experiences, with over 2,500 members in the group. Check out mattdominance.com, where you can get a free ebook which I wrote, 5 things I wished I had known before my hair transplant, which can offer you some mistakes, things I mistakenly have done throughout my hair transplant research. A couple of years ago, I think it was 4 years ago, when I got my first hair transplant, things you can learn from. So make sure you check it out. Definitely check out Eugenix, and if you are interested, obviously get in touch with them, get a quote from them, and see what they think about your situation and whether you are suitable hair transplant candidate or not. Thank you so much for watching, and I'm going to be seeing you soon.